Take cover and hide. Someone had a gun. Move quick. Austin and his buddies ducked under their table. A few minutes later, the shooters arrived, firing indiscriminately, shooting Eubanks in his hand and knee and killing his best friend instantly. Medicine helped Austin deal with the pain, but not with the scars or the drug addiction that would follow. He spent the rest of his life battling those addictions and made it his mission to help others battle theirs too, whether they involved prescribed medications that never proved enough or painkillers that never did enough. Austin knew their pain, and he would help them with their pain, never too far removed from his own, as this chat with me little more than 4 weeks ago proved.
I've always been able to recall everything that happened that day, but it was almost like I was watching it on television. I wasn't present in my own body. So it was a very surreal experience that took me many, many years to process and heal from.
You had a lot of pain and things, addictions to get through yourself after this, and you've since then tried to turn this tragedy around for other kids and families who deal with this and so much more. Tell me a little bit about that.
Yeah, I mean, I think the hardest part for communities, injured survivors, families of those that were lost and injured is the years that come next, because it's really, really difficult to heal this emotional pain and trauma. And so for me, I was prescribed medications for my physical injuries, and immediately I became drawn to those medications because of how they improved the underlying symptoms of emotional pain. And that led to a pretty debilitating addiction that spanned the course of my 20s. So now the core of my work today is in helping to educate communities and administrators and legislators about how we can effectively heal this emotional pain and hopefully eradicate these issues or lessen them from future generations.
Did you have any of this survivor's guilt? Tragically, we've learned of students in Florida and elsewhere who've committed suicide themselves after experiencing what they went through. And even the case of a dad in Connecticut who lost his 4-year-old in a shooting there, the same thing. How do you help people with that?
Yeah, I mean, I think survivor's guilt is one of the most difficult things to overcome. So obviously all of the symptoms of PTSD, the nightmares, the flashbacks, but survivor's guilt is really separate from that. It's the question of why me? Why did I make it out? Why did everything happen the way that it did? And the constant going back and saying, what could we have done differently? And so healing from that is incredibly difficult. And that was one of the hardest things for me to overcome. And so I think part of my work today is in talking to communities, survivors about this and encouraging them not to compare their healing to somebody else, because we all have a different path and we all have a different level of resiliency for what we perceive to be traumatic. And so recovery is unique to everybody, but it requires that you stay present and that you're willing to work through the stages of grief in a healthy fashion without turning to medicators to be able to cope. Having had the chance to work in many communities, I tell them one of the biggest areas where I went wrong is I withdrew from human connection entirely. Instead, my senior year, I got a private tutor who came and brought my assignments to me. And having had the chance now to reconnect with many of my classmates, what I've realized is that I missed out on a lot of the collective healing that they experienced in our senior year because I thought that substances were the answer. And so I tell people who are struggling, the most crucial piece of recovery is staying connected to other human beings for support, because we are so prone to detachment and there's countless adversity that comes with that.
What an incredible young man, and now he's gone. Austin Eubanks' family has since put out a statement saying he lost the battle with the very disease he fought so hard to help others face. He isn't the first, and sadly I suspect he will not be the last. Good, wonderful, generous human beings drawn to medication to get them through something bad, only to be sucked into something much worse. Every day, each day, every day, more than 130 people die after overdosing on everything from prescription pain relievers and fentanyl to heroin and a myriad of toxic mixes in between. That's according to the National Institute of Drug Abuse. It says it's getting worse. Most are young, some are just kids. For many, it starts innocently enough, a doctor prescribing some pills to help them through an injury or a spasm or nerves or anxiety. Just a little something to get them through something, to escape something, until folks like Austin realized they needed more, much more, to deal with that something. Then more again, maybe just one more pill, just one more prescription, just one more chance to not feel any pain, embracing and fighting the peace that came with an addiction they suddenly could not control. An addiction tragedy that claims nearly 50,000 lives a year and growing at a rate that has scarred almost every family in America. Nearly 1 in 4 who are prescribed opioids for pain will misuse them. Some of those who transition to even tougher drugs will die from them. Perhaps it sadly takes deaths like Austin's to stop and make you think. This isn't stopping. We all have to think. So that's why today it is the issue of addiction with which I am starting, and not just addiction to pills, but the behavior that addictions lead to pills, or worse, everything from technology and gaming to social media and gambling. They're all part of this. They are all in the mix. Today, we are going to try to make sense of this with the top psychologists on why we can't seem to control this. And 2 congressmen, one a former, other present, who are dealing with this at their level and trying to help families avoid what one congressman has seen way too often on his own. Then we've got a panel of top medical and economic minds on the very real business impact if we as a country do not get this right. We begin with a psychotherapist. Karen Ruskin sees these addictions every day, those who have them and those, yes, even like Austin, who succumb to them. Doctor, it's very good to have you. Thank you.
Thank you for having me.
You know, I was so impressed. I got a chance to interview so many great people, my line of work, yourself included. But this young man so impressed me from the harsh and horrible experience of seeing his friend shot dead right before him, his own battle with that, his own demons, and the drugs that he took to get him over that, and ultimately succumbing to all of that. I wonder, what went wrong? What goes wrong? You see it up close. Help me here.
I'm so glad we're talking about this. This affects so many people's lives. Neil, there is a fine line between physical pain and emotional pain, and the utilization of drugs helps squelch and numb, if you will, the physical pain while we're supposed to be on this journey of physical healing. But what happens is it's also numbing the emotional pain. So often the person doesn't even have the opportunity or the chance, if you will, to develop coping mechanisms in order to cope with the trauma, in order to cope with the emotional anguish. So then it shifts from using a drug to misusing to dependency to ultimately addiction. And unfortunately, that is the cycle that too often happens instead of confronting the emotional anguish within.
And I sometimes feel for Austin, all of 37, you know, and I'm thinking he's got that weight of trying to help all these people, and the foundation he set up to do just that, to help all types of people deal with all types of pain, all types of addiction, way beyond just those who are victims of shootings or survivors of shootings, to just everyday people dealing with stress. And I remember him saying, I've never seen us so stressed out. What's going on?
Yeah, we are a culture of numbing of our feelings, and we're not learning how to cope. And what's happening is we're actually rewiring our brain. Those endorphins that we're utilizing, they're artificial when we use a drug. So our brain is no longer producing those healthy endorphins. Plus, when we spend time in any form of addiction, whether it's drugs, whether it's social media, whether it's technology, what's happening is we're no longer in the world of the now. We're escaping from that. And that actually causes us to not be able to deal with everyday life stressors, causing us to be stressed even more. I'm so impressed by what he did, and my heart goes out to him and his family. To be helping others is so good as a tool when one has been through trauma, but sometimes it can really take a toll on that person as well.
As well, indeed. Doctor, thank you so much.
Thank you.
So it comes back to a point the doctor mentioned. Is there anything then the government can do? Now, the president's already formed an opioid